the number one thing to understand about breast reconstruction is that it is secondary to the treatment of breast cancer. The primary thing is treatment and cure. We love to make the breast symmetric. We love to restore the breast, but that is not the primary. And a lot of times when we as plastic surgeons see patients, we see them parallel with the breast oncologist and the medical oncologist, and people want to automatically full steam ahead into reconstruction. And that's great as long as that's an option for you. So depending upon the extent of the breast cancer and how much you need to have done, whether or not you need radiation following surgery, all of those things will impact whether you're a candidate to have immediate reconstruction. Because if we reconstruct the breast and then you have radiation, that can negatively impact what we do and then make further reconstruction mandatory. So it really depends on the individual patient. There are a lot of patients who, if they have a very small cancer or we think the risk of them requiring further chemotherapy, further radiation is low, then we can do immediate breast reconstruction, whether that is using implants, which we do a lot of the time. As long as we can preserve the majority of the skin of the breast, we can do implant reconstruction right away. Or we can put something called tissue expanders in, which are basically very hard implants that we can inflate over time. Or we can use your own natural tissues, whether that's your back muscle called the latissimus dorsi, or using your abdominal muscles. Or sometimes there are people who use your thigh skin and fat to reconstruct the breast. So there are a variety of different ways to reconstruct the breast, but the most important thing to remember is that it's secondary. The primary thing is treating and getting cure, and then we can do a variety of things to make you symmetric. The other thing we can do is if you require a lumpectomy, meaning you're not going to have the entire breast removed, just a part of the breast, then we can do a breast reduction on the other side to make the breast symmetric. So the list goes on, and we never see two patients who are the same. So what may be great for you is not going to be the same for your neighbor. So a lot of times we as plastic surgeons and the breast surgeons and everybody, we're getting but this is what my neighbor had, and this is what I want. But that it's tailored to you, and that's how you want it. You don't want just a garden variety, no frills brand reconstruction. You want something that's based on what you require. So it's a continuous process. So sometimes it's just one stage, and sometimes it may take 6 months or a year, or sometimes we have to come back and revise the breast. So you're stuck with me and everybody at this table forever, or for a long time.